Dr. Meg Rodgers is the Senior Veterinarian at the WA Wildlife Hospital. She is responsible for oversight and veterinary care of the thousands of wildlife cases presenting to the hospital each year and wears many hats within the organisation. Dr. Rodgers has volunteered at WA Wildlife for over a decade and was offered employment in early 2018. Since then, she has completed a Masters of Veterinary Studies in Conservation Medicine through Murdoch University. She is currently working in both small animal general practice and wildlife medicine. Dr. Rodgers' passion for wildlife extends beyond the walls of the WA Wildlife Hospital. She is active in educational programs, public awareness campaigns, research and disease surveillance initiatives, wildlife rescue and emergency response work. Currently working on a WWF Australia funded training project, Dr. Rodgers aims to build capacity within the veterinary industry for wildlife emergency responses, as well as improve welfare outcomes for wildlife presenting to GP clinics in Western Australia. She firmly believes in the power of education and advocacy to create lasting change and spread awareness about the importance of wildlife conservation and animal welfare.
Thanks, Dean. We'll talk later. Welcome, everyone. It's really nice to have so many people here that are really passionate about wildlife care. I suppose I'm here today to talk about upskilling GP vet clinics, but I realise that's not necessarily relevant to all of you, or doesn't appear to be. But I suppose for a bit of background, I've obviously started in rehabilitation, and as many of you probably did, started being the young person in the community that just took in all the little wildlife patients that came in without any necessarily formal training to start with. So that's how I started many years ago as a teenager. And one of the things that I found quite distressing is that when I had a little wildlife patient that came in that was sick or injured, trying to find a vet that was both able and willing to help was quite a challenge. And I'm sure many of you could relate to that as well. Luckily, things have improved quite a lot over the years. I remember being very devastated that some of these patients were dying. I did what I could with the knowledge that I had. I tried to seek help, but it wasn't always available, and made the decision sort of there that, this is what I want to do with my life, is I'm going to go and change the veterinary industry and make wildlife medicine available for all of the wildlife carers and the wildlife patients that come in. Of course, not realizing how big of a job that was going to be. But I've joined WA Wildlife, which was then Native Arc, and learned a lot of amazing things from the likes of Dean and many other incredible rehabilitators in the community, and also went through veterinary school as well. So obviously I've been the wildlife carer that's desperately trying to seek help for an animal. I've been the general practitioner that is being bombarded with consults and bombarded with things that I need to do, and also trying to stretch to do the wildlife patient in between all the other things that I'm doing. And I've also been the wildlife vet that has received the birds with the mangled legs and broken bones and things that really should have been dealt with at a GP clinic. So I see you. And look, I'm running this training so that we can get better outcomes together for wildlife. And we're hoping in the very near future, we should be launching some rehabilitator-centric trainings as well. So this one was developed with WWF. So they came on as the sponsor for this particular project. We are seeking a sponsor for the rehabilitation one, if anyone is interested. But the purpose of this is to try and get better outcomes for wildlife in WA, because we realise there has been such a deficit for so long. And look, there are some amazing vets in WA that do a lot of wildlife work, but there is obviously a lot of upskilling that still needs to happen in this space. So this was to try and bridge that gap a little bit. So to kind of have a understanding, or to have a appreciation for what vets do in the community and an understanding of how this sort of works, it's really important that rehabilitators do understand the limitations that vets have and the challenges that vets face, so that we can sort of have that mutual respect. As you probably know, in Western Australia, we have very limited resources dedicated to wildlife. And because we are such a large state, it's very difficult to get that resource out to all of the areas where it needs to be We're fortunate to have 2 wildlife hospitals in Western Australia. Both of them are in Perth. And we have 4 wonderful major wildlife rehabilitation centres, also in Perth and surrounds. And the rest is left to wildlife carers that are doing things out of their homes and small networks. And, they all do amazing jobs. But, obviously there's going to be limitations and you're working one-on-one with vets. So this is going to be relevant and important to you as well. So if you do have a vet that works with you a lot, do encourage them to do the training. It's free, free until October. So what we really need to look at is how we can achieve together better welfare outcomes for our patients. How does this work? There we go. All right, so it's important to understand what the roles are of the vets in wildlife and the challenges that they face. So vets don't actually have a legal obligation to treat wildlife. They have a moral obligation to treat wildlife, but beyond alleviating suffering, that vet's not required to pin that wing of that bird that's come in with a broken arm or a broken wing. Vet practices do lose money treating wildlife. So the vet practices are all small businesses. They don't have a fund coming from the government to pay for the wildlife services. So there needs to be an understanding of, well, who's actually paying for that service? Are you as the rehab group paying for that, or is the vet footing the costs, or do you have some sort of compromise in between? And a lot of vets don't actually have any training in wildlife handling. I was quite surprised going through vet school, going into vet school, looking forward to doing all this wildlife work and wildlife training. I think we did one course or one unit on everything that wasn't a cat, dog, or livestock animal. And a very small percentage of that unit was wildlife. So just so you kind of have an understanding of the base level of knowledge of wildlife in the curriculum in Western Australia anyway, like that's the standard that we're at. I'm not saying that there's not other areas where we get information that's applicable to that situation. So obviously all of the medicine background is applicable. It's just we're not specifically trained in a large capacity to deal with the species that we're presented with in wildlife medicine. If the vet staff don't know what they're doing, that also is a risk that the practice is taking on. If you've got vets that are treating a venomous snake or a large raptor and they don't have any training in how to manage that, then the vet clinic itself is taking on that risk to manage that patient. We are very time poor usually when we're working. Like there is a big crisis in the vet industry at the moment of just not having enough people. So we're constantly stretched, we're on the go. The vet nurses end up being the heroes of wildlife in a lot of practices because the vets just don't have a lot of time. So the vets end up being usually the decision makers and the nurses are the doers. Vets also are at the mercy of clinic protocols. So some vet clinics won't see wildlife. Some vet clinics will only allow vets to see wildlife within designated times or in their after hours time or their unpaid time, because these are practices too. These are small businesses too. So they need to be able to dictate, where their money's being spent if they're allowing staff to perform procedures and to do consults for wildlife patients if they're not recouping any of that cost. And vets are often discouraged from seeing wildlife, as we've discussed, if there is going to be a risk to the clinic, a risk to staff safety, and a risk to reputation of that clinic as well. And I have seen this happen. All right. This is a little bit annoying. Okay. So there's a lot of challenges that we face when we are doing wildlife medicine work. A lot of cost constraints, obviously, and we don't have an endless pit of money in an average vet clinic to be able to treat every single animal that comes in. At the WA Wildlife Hospital, we'll do quite a lot of work with what we've got. I mean, we'll do tendon repairs, we'll do orthopedic surgeries, we'll do all sorts of different things, but the average general practice vet clinic is not going to have a stash of cash available to do that. So the question then becomes, well, who's actually paying for that service? Is the wildlife rehabilitator taking that on, or is the vet clinic taking that on? There's often limits to access of information. So there is a lot of fantastic information out there for wildlife medicine, wildlife vets. There's great textbooks. You've got Anne Fowler's manuals, which are fantastic, but a lot of the information networks are restricted, or require subscription, or there's multiple different areas that you need to access them from. So the average GP vet doesn't have access to a huge amount of information on that species, or if they do, they have to troll through big textbooks and big documents and things to try and find the information that they're looking for. And there's usually limited availability of tests, so you can't just send a beak and feather test to your regular lab. That vet clinic then has to work out, if you want a beak and feather test, they need to establish a relationship with a laboratory that's separate to their other lab that's going to do it for them, and then fill out all the different paperwork and send it all off. Like, there's a lot of administrative process that goes on behind the scenes for that sort of thing as well. And there's limited drug availability often as well, different ethical dilemmas. So we touched on this before. Do you treat that patient not knowing if the rehabilitator is going to bring it back? Is it going to get follow-up care? Is it likely to have a good outcome post-release? So there's a lot of these things that weigh on us as well as vets, is making that decision of whether or not we do rehabilitate something or release that animal into someone else's care. And that comes back into that trust and delegating care as well that we discussed. So vets have a responsibility to be an advocate for animal welfare. They will usually provide diagnostic procedures or diagnostic tests and surgical procedures, whatever is needed for that animal, but they're the decision makers in this situation. So they'll provide consults if there's some sort of mutual agreement there, and they'll perform euthanasia if rehabilitation is not an option. And again, this is not something that we take lightly. I remember going into this whole journey thinking, you know, I'm going to save all the animals and it's going to be great. I remember going to Anne Fowler's talks thinking, wow, she euthanizes a lot of stuff. Sorry, Anne. Going from that sort of mindset to actually being in it and seeing failure after failure and patient after patient coming through, euthanasia becomes a blessing. So I probably went from the least body count vet ever to one of the highest within a very small period of time. And look, that's not from a lack of compassion, it's just reality, unfortunately. And if we're not going to be able to rehab these animals and give them a viable outcome at the end of the day where they're actually thriving in the wild and able to find food, then that's not a good outcome for that patient. So euthanasia is the kind of option, and unfortunately our legislation doesn't really allow for much of a medium ground at the moment either. So the other thing that vets are useful for is if there are notifiable diseases, as we've discussed with Wildlife Health Australia, they can liaise with those authorities and get things investigated if we feel they're necessary. RVNs are the powerhouses of the veterinary clinics. So shout out to Georgia and Charlie and Kelly, who are all here today from the Wildlife Hospital. These guys are, yeah, amazing. So these are vets, nurses actually have a really, really important role within the veterinary clinic and within the veterinary industry as well, because they're gathering a lot of that initial information. They're turning the patients away that don't need to come into care. So all those baby birds and pretty healthy things that people have just kidnapped and need to go back to where they've come from. So they really play a big role in that education of member of the public, gathering the important information that we need to know as vets and as rehabbers for that long-term plan. Yep. And they communicate, and they often will provide the first aid and triage assessments of these animals as well. So they'll be the ones that initially get in there, save the patient, harass the vet, make sure the vet's giving the treatment that it needs and making sure that that animal is going to where it needs to go. So the nurses, because the vets are often so time poor, the nurses are really the ones that a lot of the time take up the reins. And interestingly, as you'll see later on in the presentation, that's made up a lot of the demographic that had interest in the training as well. So they are also very skilled and will perform a lot of these things. So a lot of the diagnostic procedures and things on behalf of the vets as well. All right, so wildlife rehabilitators also advocate for animal welfare. Notice that this is on all 3 slides. We've all got a role to play in this. So where the wildlife rehabilitators, which is yourselves, a lot of you, really play an important role is having that knowledge of the species and that background information on, okay, where does this animal need to go back to? What important environmental factors do I need to consider? Is this animal likely to survive post-release? Because the vets won't know that information. The vets aren't trained in, the magpies and their antics and possums and what their post-release outcomes are and where the appropriate release location is for this. Like, that's something that wildlife rehabilitators are very knowledgeable in. And that's where the vets need the advice of the rehabilitators to dictate viability or outcome-based viability on whether or not we can release something. So it's important, both sides are important, but we do need you to present that information to us and have those conversations with the vets, because that knowledge is not necessarily there. We can provide advice on viability of a particular fracture or a particular medical condition, but we can invest funds and invest resource all we want and treat up that magpie with the broken wing and then have it all good to go 6 months later when the tribe's already forgotten about it and decides to beat it to death as soon as it's released. So it's really important that you're communicating those little things to the vet. So often the rehabilitator will be organising placements as well. This is going to vary a little bit depending on how your organisation works, how your network works. You can provide advice to your vet on husbandry and feeding and all these important things that they need to know while they're keeping these animals in care, even if it's just for the short term. Carry out the treatment plans as the vet advised. Please don't then decide that you're going to put it on a different antibiotic and try this and then add something into the milk to make this. Like, follow the plan that your vet has directed. When you start changing things, it makes it very complicated. So there needs to be that back and forth communication as well. And organize follow-up appointments, give feedback, because otherwise the vets aren't going to learn what the outcomes are if you're not telling them all this happened. And the same thing is going to continue to happen over and over again. So that honest communication is really vital to a lot of these relationships and foster good ongoing relationships. So please don't show up an hour late to your appointment. Please don't post slander online. It really helps if you bring a box of chocolates to your vet every now and again, a bowl of wine, whatever you feel like. Vets love it. Even just the little things like a little note, like a thank you note or a Christmas card or an appreciation post on your wildlife group, or inviting them to trainings. Like, they do appreciate all these things. They may not take you up on things like days out or picnics or but just the little gestures make the biggest difference, especially for business owners. If they're taking on any cost, if you can help offset that with bringing in business to their clinic, then that's a really good way to promote them as well. All right, so the goal for us for this particular training was to make sure that we had some sort of training package that would enhance the skills of vets and veterinary nurses, treating wildlife in medical trauma situations, especially bushfires, and also provide some sort of knowledge on basic triage, basic husbandry, what to do when these animals initially presented to the clinic to try and get some better welfare outcomes there. So we've been very grateful to WWF, who have sponsored this training, and it is still available free of charge to vets and nurses until October. And that's for not just Western Australian vets. Like, we've had an amazing interest internationally and nationally as well. So if you've got vets that are interested in wildlife but just want a basic low-level training, encourage them to sign up. All right. So WA's got some unique challenges when it comes to wildlife medicine and treating wildlife. Obviously, it's quite a large space to cover. As I said, there's not many wildlife hospitals and wildlife facilities in the state. There's no formal statewide rehab network. So for those that are from other states, we don't have a WISE here. It's often, we've got the Wild Care Helpline, which is a fantastic resource now, but there's not a whole statewide network where the placement of animals is dictated. So a lot of the work that we do relies solely on GP clinics and wildlife rehabilitators that are working out of their homes. So it's quite a different setup to a lot of the other states. The rehabbers are often isolated from the veterinary professionals. I know I went up to Karratha and did a presentation on reptile medicine or reptile husbandry and rehabilitation, and I went up there and was explaining how to deal with the situation and when you need to see a vet, and they were saying, well, we don't have a vet up here. there's no vet in Karratha. We have to travel up to Port Hedland on Tuesdays and Thursdays, and that's when the vet comes in. So it is challenging. I'm not denying that, and we're not going to solve everything overnight. But just so you know, there's obviously some ground that needs to be covered there in WA. There's variability in skills of rehabbers, there's variability in skills of vets. I think it's important to have those discussions with vets on what cases you're happy to take on, what you're willing to take on, because that's going to dictate to what we decide to release. We don't want to give you a critical animal that needs subcut fluids or IV fluids or something if you have no training in how to do that. So it's important to have those conversations up front. And as I'm sure a lot of you in WA are aware, there's been some recent change in legislation when it comes to wildlife rehabilitation. And I can pretty much guarantee you 95% of vets won't be aware of that new legislation when it comes to wildlife rehab as well. So it's important to have those discussions with your vet clinics too. So when we were looking at creating something that would be valuable for WA, we wanted something that would be fairly low level, so easy to understand, easy to access, focused on WA species and legislation. We've got some amazing trainings that are available, like the Taronga one was fantastic, I did it, but it was very koala focused. Obviously not a big thing that we need to deal with in Western Australia, and it was very high level, I found as well. Like what we needed locally for GP vets in Western Australia was something that was very basic, taken down to a basic level, how to set up a cage for this, how to handle this, what to do initially when something comes in, how to treat burns. So it was very deliberately very low level so that it was accessible for the average general practitioner in general practice. And it was accessible for time poor professionals. So as we've discussed too, vets are usually very busy trying to manage everything. But we figured that an online platform would be the best way to deliver this training, and giving them a reasonable period of time to complete that online platform as well. So it's not a huge long course. It'll probably take about 20 hours to complete if you go into all the little links and bits and pieces, but they can do it in their own time. So there's no requirement for them to come give up a day, sit down and go through a whole training program if they don't feel that that's achievable for them. So we wanted to have realistic expectations in there for triage, husbandry, euthanasia decision making, and really the basics that they need to know for wildlife treatment. And we wanted it to be complementary to a lot of the other trainings that are available too. We didn't want to reinvent the wheel, so it's very WA focused. So we did a bit of scoping to start with. And we sent out some surveys with Vets Beyond Borders and the AVA to just get a bit of an idea initially of what people wanted in a training, or what veterinary professionals wanted with the training. As you can see, veterinary nurses made up the majority of the demographic that responded and were actually interested in wildlife training. And a lot of those people were in small animal clinics, a very large percentage of them. And the number of the caseload that they got was quite low. So it's a bit hard to get a lot of experience in dealing with wildlife if you're only seeing 5 cases a week. So just bearing that in mind as well, it will take a little while for these skills and things to get developed, but a lot of the people that were interested were not seeing a huge amount of wildlife in their practices. So you can see there's not a huge amount of confidence to start with based on the survey responses. And bear in mind too, this is a voluntary survey, so the people that actually responded to the survey are the people that are interested in wildlife and interested in training. So this is a little bit of a concerning number. But the confidence in euthanasia decision making was a little bit high, or higher than the general confidence. And as you can expect, we looked into the reasons for euthanasia too, and a lot of, as you'd expect, the biggest reason for euthanasia is for an injury or illness that makes the patient not viable for rehabilitation. But the interesting part is looking at the other bits and pieces as well. So these are barriers. So obviously, if they're unsure how to treat, that becomes a training thing. If they're unable to find an off-site rehabilitator, and that's something else that is a barrier. Lack of time is another big one that's being discussed, but interestingly, it's not the top it's not the top reason that vets are euthanizing wildlife. And lack of appropriate resources and equipment is the other one that was discussed. All right, so obstacles preventing vets from treating wildlife: equipment, skills, knowledge, lack of time, nowhere to take the patient to. Difficulty of conflict with wildlife carers is about 16.4%. So just be aware of that number. I know a lot of people deny that it's a thing, but I can guarantee you it's a thing that's preventing people from treating wildlife, is that concern about judgment and concern about conflict. All right. So based on the response, most of our demographic was vet nurses that were interested in treating wildlife in general practice. One of the biggest obstacles identified was lack of skills or knowledge, and I want to improve those knowledge. So we've developed this training program based on that feedback. So the positive part of this is that there is a thirst for that knowledge, and there is an opportunity here to be able to provide that information for people to make that medicine more accessible. So we developed this training session. We've provided all free of charge, sponsored through WWF. And the online module we initially developed was just basic things: wildlife first aid, husbandry handling, viability assessment, euthanasia, and wildlife care in emergencies. And we also offered a practical training session as well. So we've done once of those a month for the last 6, 7, 8 months, and they've been pretty popular as well. But the online training is a prerequisite to the practical training. So in the online modules, there's also a lot of really useful downloadable resources such as drug charts, admission forms, and just easy things that can be implemented into clinic practices. So our pelican. Our enclosure at the moment is a lot more full than that. So far we've had quite an amazing response. I was blown away by how many people actually signed up. So we've had 900 people enroll, about 230 or so have completed the training so far. There's been a lot of international interstate response, which has been fantastic. It was interesting going through all the registration certificates, and they're from like Turkey and Syria and all these other places, and trying to work out if they actually fit the criteria. We've done practical training sessions. We've done one with lots of veterinary students as a trial session, which was interesting. But then 36 or so vet professionals have completed the training so far. And the challenges that we face, just in case anyone else is deciding to run an online training session, is avoiding information overload. So it's so easy once you get started delivering information to go down this rabbit hole of more and more information needing to be provided. But we really needed to keep it simple and accessible. The navigation of the software was a little bit challenging. We went with a Thinkific, which was quite useful. The logistics of managing exclusive content was quite hard. So because of the contract with WWF, it was restricted to vets and vet nurses that were currently practicing. But of course, that required a lot of gatekeeping and making sure that we had registration certificates and manually enrolling all these people into the course. And as Anna can attest, this was quite a labor-intensive process. And look, it wasn't deliberately meant to be exclusive. That was just, unfortunately, the restrictions that were put on us with the training. But as we said, we'd love to do a wildlife rehabilitation training as well. And we wanted to cater to a variety of skill sets, and the availability of vets for peer review is also a bit of a challenge. So we developed all this content, but then trying to find someone to actually review it for us was quite challenging because everyone's so busy. So massive thank you to Simone Vitali, to Diane Hackoff from Zoos SA, and also to Leanne Yeep from the Murdoch University College of Veterinary Medicine. They've all been fantastic in that space and giving us feedback. So after the training, you can see the confidence level has gone right up, which is what we were hoping for. We did have, unfortunately, the people that were reviewing the training also completed the course, the post survey. So we had a couple that were no improvement because I know all of this. That's okay. So there was a lot of positive outcomes from the training that we've seen so far, based on the post outcome surveys. And look, most people said they'll probably treat more attempt more treatment for patients and would probably refer more patients to wildlife vets based on the knowledge that they'd obtained from the training, which is great. This is a bobtail cesarean that we did a couple of years ago. So we did want to get an idea of what was motivating people to undertake this training as well, because obviously that has implications for why we're running it. Most people indicated that their desire was to increase their knowledge. Some are already working in zoo or wildlife medicine and were using it for a refresher course. Others wanted to kind of get into that career path, so we're just looking for something else to add on the resume. Several people said that, look, they took it because it was free, which is still great, but had it... Sorry, what was that? Oh, sorry. So a lot of, sorry about that, a lot of people had said that they did the course because it was free, but had that course been charged for, they probably wouldn't have done it, but that was only a small percent. So the overall feedback, here's Ryan with one of our wedge-tailed eagles. The overall feedback has been overwhelmingly positive, which is great. About 95% of people reported that they felt better equipped to make assessments of wildlife patients and viabilities as a result of the training, which is obviously what we were hoping for. And most participants said that they'd be more likely to attempt treatment and refer patients, which is great. So when put into practice in GP clinics, we're hopeful that this will improve welfare outcomes for the patients that present. So there's still a little bit that we need to work on. Like, this is not going to fix everything, and we're well aware of that. Based on the survey responses, we also asked, like, what other barriers are in place, like what else do we need to work on, how else can we help you? And look, the things that were remaining were basically if there was a lack of facilities, lack of appropriate PPE, look, sometimes, and resources in the clinic, and this is something that you can assist your vets with. If you can provide some PPE, provide some resource. Understaffing and time poor staff, lack of practical hands-on experience, knowledge about treatment options and therapies, financial cost, lack of knowledge about anesthesia protocols. There's a few bits and pieces that we still need to work on. But when we asked what we could do, one of the biggest things that came up was there's this real desire from GP clinics for an easy guide for treatment. For common conditions and how to go about just treating general things that come into the clinic, so they're not having to flip through lots of textbooks and resources. So one of the things that we've looked at doing now is redirecting our scope and putting together a manual that is, don't worry, Anne, we're not going to put you out of business, a WA specific manual that's got all of the different species groups in there with just really easy to reference treatment guides, husbandry guides, so that we can distribute them to vet clinics and they've got something that they can really easily use, and that will make wildlife medicine a lot more accessible for them. So we're hoping that that should be published by the end of the year. And we do also want to keep producing lots of content, keep producing lots of different projects for wildlife rehabbers as well as vets. And that this is all very exciting. Yeah. So hopefully if we can work on the veterinary industry, and if you can help me work on the veterinary industry and encourage your vets to sign up for these trainings, we should be able to create some much better welfare outcomes for wildlife in general practice.
All right, we are bang on time, so we won't take any questions. Meg is hanging around for a little bit, so feel free to come up and harass her. Sorry, Meg. We're going to generate one more prize, and then we have our Sundowner event at 5:30. So get your lanyards ready. All right, number 89. There we go, no worries. So I'm just over the side here, Lauren. Now, before we run away, thanks, Meg. Oh, you took your gift already. There you go. No. All right. Look, we are running exactly on time, which is fantastic. Really appreciate all of our presenters today sticking to time. That was brilliant. All of the presenters, for those of you that don't know, none of them are paid to come and present at this conference. They all volunteer their time to come here. And in fact, many of them have flown interstate, so they've actually absorbed quite a huge cost personally to get to this conference and deliver that information. And it really goes to show again the wildlife community and just how much these people continue to give. You would very rarely see that in any other sort of conference, professional conference, medical conference. So big round of applause to all of our presenters for giving up their time.